My name is Audrey Zadunich, and this is my daily patient reassessment video. Before entering the patient's room, I would make sure to check the electronic health record for any new or needed orders, as well as recent lab values, and I would also make sure to check the doorway for any markers regarding PPE or anything like that. But I don't see anything here, so we're good to head into the patient's room. Hello.
Hi.
I will first perform hand hygiene. My name is Audrey, and I'll be your nurse today. Can you please provide me with your name and date of birth?
Jocelyn Elwine 080406.
Perfect. I'm just going to verify that with your patient wristband. Perfect. And now tell me what brings you in today.
I have a headache.
Oh, I'm sorry to hear that. Is there anything that makes this headache worse or better?
It gets better when I sleep.
Okay, good to know. And then can you describe what the pain feels like exactly? Is it sharp or more of like a pulsating pain?
It's a sharp pain in the back of my head.
Okay, and then you said it's in the back of your head. Does it kind of radiate or move anywhere else, or is it contained in that one area?
It's just the back of my head.
Okay, perfect. And then I have this little pain rating scale card. Can you rate on a scale of 0 to 10 how bad the pain is?
I would say a 6.
Oh, I'm sorry to hear that. Thank you. And then when exactly did this pain begin?
It began last night.
Okay, so fairly recent. Thank you. Moving on to general appearance, I would note that my patient seems fully awake and alert. In order to orient to person, place, and time, I'll ask, Jocelyn, do you happen to remember my name?
Audrey.
Perfect. And then do you know what building we're in right now?
We're in a sim lab in the Casey Center.
Perfect. And do you happen to know the date today?
July 14th.
Perfect. Thank you. The patient seems fully alert. If not, I would use the Glasgow Coma Scale to assess the patient, but now we can just move on. I will measure the size of the patient's pupils. This one appears to be 5 millimeters. And this one is the same, 5 milliliters. Now I'll test pupil constriction. I'm just going to shine this light in your eye real quick. Perfect. Same thing. Okay, so I noted direct and consensual pupil constriction in both eyes. Now looking at the patient's face, her facial expression appears relaxed, no drooping. And tell me about your ability to swallow. Can you swallow just fine?
Yeah, I don't have any problems with swallowing.
Perfect, thank you. And then moving on, I would note that the patient is speaking clearly, responding well to questions, responding with appropriate content, so no problems there. And then I would also note that the patient's posture appears relaxed, good body alignment, and I don't note any odors or anything like that. Hygiene appears adequate, so no need for further care. And then I'm just gonna pull this down. Thank you. I would note that the patient's skin appears tan with appropriate pink undertones. Skin also appears dry. And now I'm just going to move on and test muscle function. Would you be able to squeeze my fingers with your hands? Perfect, thank you. And then put your arms like this and push against mine. And now pull back toward you. Perfect, thank you. And I'm just going to go down to the feet. Same thing, push toward me. Perfect, and pull toward you. Perfect, thank you. And then can you kind of wiggle your fingers and toes around for me? And is there any numbness or tingling sensation?
No.
Okay, perfect, thank you. Now we're gonna move on to vital signs. I'm gonna use this temporal thermometer to measure your temperature real quick. Temperature is 98.8, so that is normal. And then moving on, I'm going to measure your apical pulse. So if you don't mind, I'm just gonna lift your shirt up.
Go ahead.
I'm just gonna find your apical pulse. Okay, now I'm just gonna use the clock to count. Okay, so your apical impulse was 72 beats per minute and it was regular. And then your respiratory rate was 18 and it was unlabored. Thank you. And now, moving on, I'm going to first estimate your systolic blood pressure using this blood pressure cuff. So just give me your arm, please. Thank you. And this is an adult size blood pressure cuff and it seems to fit just fine. Okay. Would you mind holding this for me?
Yep.
Just like that, thank you. I'm gonna find your brachial pulse. Perfect. Okay, and I stopped feeling your brachial pulse around 110, so I'll pump to 140 for your actual blood pressure. And I'm gonna take this off now. And we'll just lie it here. And we'll give your arm a rest while we take your pulse ox on the other finger. Thank you. Just rest that on your leg. O2 saturation was 98%. Perfect, thank you. Now going back to blood pressure, I'm gonna put this around your arm again. Thank you. And then just rest this on your leg. Okay. Would you mind holding this again for me?
Sure.
Thank you very much. Perfect. Okay, your blood pressure was 108 over 72, so that is normal. I'm gonna take this off. Thank you very much. Okay, now we're going to move on to respiratory. If the patient happened to have an oxygen mask or nasal cannula or anything like that, I would ensure that it's fitting properly and the flow rate is correct. And then I would also ask the patient, have you had a cough lately?
No.
Okay, so no mucus or anything?
Nope.
Okay, perfect, thank you. And if the patient was having difficulty breathing, I would teach them correct breathing technique and maybe even use an incentive spirometer and instruct them on how to use that. Moving on, I'm going to auscultate your breath sounds. So would you be able to maybe sit up and dangle your legs over the bed? I think that would work the best. Thank you. I'm gonna listen to 6 breath sounds on the 6 regions on the front and 6 to 8 on the back. So I'm gonna lift this up as much as possible. I would make sure to never auscultate sounds over clothing, but for the purpose of this exam, that might happen. Okay, so I'm gonna first listen here. And can you take deep breaths in and out through your mouth? And another one. Another one. I'm just gonna put this under here. I'm gonna move to the back. Would you mind kind of just turning to the side a little bit? Perfect.
Yes.
Thank you so much. Do you mind if I lift this up?
Yes, go ahead.
Okay, thank you. And deep breath in through your mouth. Perfect, thank you. Breath sounds sounded normal. I didn't note any extra sounds, including crackles or wheezes, so that is very good. Next, we can move on to cardiovascular. Feel free to lie back against the pillow again if you want. Okay, I'm now going to assess your heart sounds in the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. So we'll start here, and I'm going to listen with both the diaphragm and the bell. Perfect. I did not note any murmurs or extra sounds. S1 was heard best at the apex and S2 was heard best at the base, so that is normal. The rate was also regular. And now I will move on to checking your capillary refill. So since my patient has fingernails, I will just press the top of the finger here. Capillary refill time is less than 3 seconds. That is normal. Perfect. And then I'm going to move on to the toes. Same thing. Less than 3 seconds. And less than 3 seconds. Perfect. And now I'm going to assess the lower extremities for any edema. All right, no edema is noted, so we're going to move on to assessing your pulses. We're going to start here with the dorsalis pedis. All right, pulses are 2+ on both sides. Now we'll do the tibial. Pulses are 2+ on both sides. And lastly, can I see your wrists? I'll assess your radial pulses. Pulses are 2+ on both sides. And I would make sure that if my patient had an IV, to make sure the fluid type and rate is correct. And also if there were any TED hose or other DVT prevention equipment, I would ensure that that is working properly. Okay, moving on to the skin assessment. I would note that the patient's skin appears intact, no lesions, dressings, IV sites. And then I would also assess the temperature on the extremities. All right, skin is warm and dry. And moving on, I would test for skin turgor on the arm here. Just gonna lift that up. No tenting, skin turgor is good. And moving on, I would use the Braden scale to assess for skin breakdown, and if the patient was on bed rest, I would make sure to check the position of the head of the bed and also implement a turning schedule. And if there were any other pressurized devices to prevent skin breakdown, I would ensure that those were working properly. Okay, now moving on to abdominal. Would I be able to get you to lay flat on the table?
Yes.
Okay, thank you very much. Okay, and that's comfortable for you?
Yes.
Perfect, and I'm just gonna lift this up. And then first I will note the shape and contour of the abdomen. It appears flat, contour is good. So now I'm just gonna get right into auscultating abdomen sounds. Do you mind if I pull this down a little bit?
Let's go ahead.
Thank you. Okay, I'm gonna start in the right lower quadrant and move clockwise. Perfect. So I noted that bowel sounds were present in all four quadrants. And now I'm going to move on to palpating. I'm also going to start in the lower quadrant again, right lower quadrant, and let me know if there's any tenderness or anything like that.
Okay.
All right, any pain or any tenderness?
No.
Okay, and I didn't note any firmness in any areas, so we can move on in our assessment. Feel free to sit back up for me. We're done
Okay.
with this part of the assessment. Thank you very much. And then, have you been experiencing any nausea lately?
I have not been.
Okay, and then how's your current diet? Do you tolerate it just fine?
Yes.
Okay, so no need to advance or change her current diet. And then tell me about how regular your bowel movements are. What's the frequency there?
Normally every day.
Okay, perfect. And then when was your last bowel movement?
Yesterday.
Perfect. And then I have this little Bristol stool scale. Can you please rate the appearance of your last bowel movement?
I would say probably type 4.
Perfect. Thank you. That is normal. And then moving on to genitourinary. Can you tell me how frequently you're peeing?
Probably like 5 times a day.
Okay, good to know. Thank you. And have there been any problems with that, with peeing?
No.
Okay. And then can you describe exactly what your pee looks like? Is it light yellow, dark yellow, clear?
I would say it's more light yellow.
Okay, perfect. And then can you tell me about how much usually comes out when you pee? Can you estimate that?
I'm not sure.
Okay, that's normal, no problem. And then have you noticed any pain when urinating or any cloudiness in the urine?
No.
Okay, perfect. So no indications of infection. And then moving on to activity. Can you tell me how walking and movement is tolerated? Can you move around just fine?
Yes.
Okay,
no
you don't
problems.
use any mobility aids like a walker
No.
or a cane? Okay, perfect. If necessary, I would assess fall risk using a standardized scale such as the Morse scale, but that is not necessary here. Okay, that about finishes up our assessment. Upon leaving, I would make sure that the bed is locked and that it is down all the way, and I would also make sure the lower side rails are down, the upper side rails are up, and I would make sure that the call light is in reach of the patient, and I would make sure to ask the patient, is there anything else I can do for you today?
No.
Okay, thank you so much for your help and your cooperation in this assessment. I hope you have a great day. And now, lastly, I would perform hand hygiene and leave the room.